Hello, everyone, and welcome to today's press briefing. I'm Donna Bush. As always, myself and everyone else here is very happy to have you with us on our various CIG television channels as well as on Radio Cayman. We begin today with a prayer from Bishop Nicholas Sykes.
Heavenly Lord and Father, we ask for the protection of your guidance upon all the statements that are made today and upon all those who speak. We thank you that the Lord Jesus has declared that he is the way, the truth, and the life. We thank you that you will grant by your Spirit that those who seek will also find your mind and heart to order wisely every circumstance. And so we pray for a special and God-given wisdom for those who have been given authority to speak as leaders, for protection for our health and frontline workers and all others working for our benefit and protection, for good provision and protection for our residents, as well as their forbearance of our current difficulties, and for the light of faith in the defeat and ending of them that is already shining upon us. And these things we commit to you, our Heavenly Father, in the name of him whose values these islands are solemnly committed to espouse, our Lord and Savior, Jesus Christ. Amen.
Thank you very much for that prayer, Bishop Sykes. We now welcome our panelists, our Honourable Premier, Mr. Wayne Panton, our Deputy Premier, the Honourable Christopher Saunders, Minister for Health and Wellness, the Honourable Sabrina Turner, and Minister for Tourism and Transport, the Honourable Kenneth Bryan. Joining us via Zoom are members of the media, and of course in studio with us are the Chief Medical Officer, as well as our sign language interpreter. We'll hear first from Premier, the Honourable Wayne Panton.
Thank you very much, Donna, and good afternoon, ladies and gentlemen. Thank you for joining us. I am pleased to share today that we have approved amendments earlier today to the COVID-19 regulations, which will come into effect tomorrow, 18th of February. So today, Cabinet agreed to a number of changes to our COVID-19 regulations aimed at supporting our economy and allowing us to safely live with COVID-19 as we continue to take a balanced and pragmatic approach to this issue. For the avoidance of doubt, I confirm that we are still in phase 5 of the COVID-19 Critical Readiness, Preparedness and Response Plan. This decision is in light of the good news that the number of positive cases continues to go down. Let me acknowledge that it is because of the success of our regulations, the uptake of our vaccination program, and the efforts of both this government and, very importantly, our community to adhere to the safety measures in place that we're able to confidently take this decision today to lighten these regulations at this time. The measures we have put in place continue to prove effective to protect our health and education systems, as we have seen limited hospitalizations and limited numbers of persons with severe illness. Though sadly, we do mourn the loss of 17 people in our community due to this illness. Now, after meeting with Dr. Newton and other stakeholders, we believe that we can safely move forward with confidence at this time. Though there are no guarantees about numbers in the future, this government is cautiously optimistic that we can move forward toward these reduced restrictions while still continuing to see a drop in positive cases. Therefore, we have decided to ease some of these restrictions in place. Now, I'm pleased to give a brief overview of the amendments made, which we know have been long sought after by many across our 3 islands, and which we feel will continue to give us in the Cayman Islands the best outcome as we balance our return to a level of normalcy with the need to minimize the negative impacts of COVID-19 on the health of our citizens and the impact on our economy. Turning to the specific changes, as I said, the amended regulations will come into effect tomorrow, Friday, 18th February. These specifically are the Control of COVID-19 Travel Amendment Number 2 Regulations 2022 and the Control and Management of COVID-19 Amendment Number 2 Regulations 2022. These regulations will do the following. They will remove the post-arrival testing regime for day 2, 5, and 7 for fully vaccinated and securely verified travelers. I want to note at this point that the pre-arrival testing regime remains in place. In addition, they will lower the quarantine period for unvaccinated persons from 10 days to 7 days. Now, with respect to inter-island travel, we will revert to the original testing regime where only unvaccinated travelers will have to have a negative lateral flow test or PCR test prior to travel between Grand Cayman and the sister islands. The restriction on vaccinated travelers will be lifted, therefore. Our social distancing requirements will remain in place, and we're also expanding the gathering limit to 500 persons for indoor activities and to 1,000 persons for outdoor activities. Exceptions will be considered only if specific criteria are met as determined by the medical officer of health. Further, the new gathering limits, as just mentioned, for indoor and outdoor venues apply to gyms and sporting venues. Outdoor sporting activities can now have up to 1,000 participants and spectators in total. This is in line with the new outdoor gathering limits. No mask wearing will be required for spectators or, of course, participants. We're also increasing the passenger capacity for boats to 500 persons, obviously subject to the vessel's own specific rated carrying capacity. Testing restrictions on gyms have also been lifted, which is quite important. Not contained specifically in the regulations, but an important part of the changes of our regime is in relation to the new exit testing regime for travelers who are partially vaccinated, unvaccinated, or non-securely verified. They will be allowed to conduct certified LFT tests on days 6 and 7, and if both are negative, they can exit quarantine on day 7. Of course, if they choose to attend the free PCR testing facility on day 7, they may do so. But the lateral flow testing obviously gives them a much quicker option. Ladies and gentlemen, I believe firmly that these relaxations through these amendments are coming at a time when they will positively impact our economic recovery, and they are helping us to resume a level of normalcy in our lives and in our activities, and they're important to us. We believe that relaxing these regulations will mean more business for gyms, and more children will be able to participate in outdoor sporting activities. These new regulations are good for business and good for families. And I know that the removal of post-arrival testing is a blessing to one and all who travel. But I do still encourage you to do your own personal lateral flow testing if you're going to be out in crowds or if you plan to visit our elderly or any of our vulnerable people. If you're negative, you're good to go. But if you are positive, please do the right thing and report to the Health Services Authority that fact. It is a responsibility of each person in our community to maintain the safety and hygiene practices that we know help us to keep safe and healthy. This responsibility includes getting your booster or getting vaccinated if you have not already done so. Cayman, I once again assure you that all the COVID-19 measures this PAC government takes are for the health and safety and well-being of our community, our visitors, and our people. I want to reassure the public who may find further relaxation of these restrictions in some way uncomfortable that we are continuing to monitor the global responses to this pandemic. We're continuing to follow the science, and we will be making changes to our critical preparedness and response plans based on the best advice and information available to us. Now, as we continue on this journey, we must have faith in our plans and confidence in our decisions that our policies are working. Thank you, ladies and gentlemen, for doing your part, for continuing to social distance, wear your masks, employ good hygiene practices, and get boosted. Do it for your community, do it for your family, do it for your own health and well-being. Thank you very much.
Thank you very much, Premier Panton. We now go to Minister for Health and Wellness, the Honourable Sabrina Turner.
Good afternoon, everyone, and thank you, Donna. I'm here today to talk primarily about the COVID-19 vaccines for our children. I know that this is a rather touchy subject, and I have received sentiments from a very variety of a number of parents and guardians. Some want to know when they can get their children, ranging age 5 to 11, vaccinated, while others are weary about having their children take the COVID vaccine at all. Now, the decision to vaccinate your children can be a hard one, I understand. But as a parent myself, we have to make the decision that is in the best interest of our children and our families. As a mother, I had to do the same. And there were times I cried, I prepared with the Panadol before they go to bed at night. But when my two sons had to get their first immunizations and immunizations period against measles, mumps, diphtheria, chickenpox, and polio. Now, as a nurse, I recall going out even in the community and assisting with the vaccine campaign, and that was back in the day. It is no different today as we learn how to protect ourselves against the COVID-19 virus. What we have to be fortunate about is that we have never experienced a pandemic until now. And though in the past the solutions may have been available to manage pandemics, for us in 2022, it is. We do have a vaccine, and one that is available totally free of charge to the public, and now to the children who are from 5 to 11 years of age. Later on this afternoon, we will be receiving 2,000 doses of the paediatric formulation of the Pfizer vaccine from the UK. And the UK heard our pleas to vaccinate our children and have given us full permission to proceed in advance of the wider rollout for children vaccinations, even in the UK. Now, this capacity to roll out vaccinations to our children will be another important tool that we have to protect our community as a whole, as the PAC government, has been doing from the onset of us taking office. Now, recently, we made available COVID-19 vaccines for the vulnerable children aged 5 to 11, and that began at the end of January. We all know that our children are impacted by COVID-19, as we have seen during the recent 2 waves and community transmissions. We have seen where schools has often been the center of these outbreaks, resulting in specific testing regimes being implemented for our school children. But please, let me be clear. We are not mandating for children to get vaccinated. It is, however, a strong suggestion, though, to protect your children, their education, and your families and friends. Also, Healthy children mean that parents do not lose time from work. Vaccinations don't only protect your children from diseases, but they also keep our children and our whole community safe by greatly reducing the transmission of viruses that can spread. We know vaccine can boost the immune system, which is the body's germ-fighting machine, and can build up antibodies to protect our children from contracting the disease, and when they're exposed, when they're actually exposed to the disease. Now, with any vaccine, there can be controversy over the safety risks, but there has been no convincing evidence of harm for the COVID-19 vaccine that we have seen thus far. While anyone, including our children, can have a reaction to a vaccine, what we need to remember is that the benefits that vaccinations pretty much outweighs the risks. As we announced earlier, the childhood vaccine, will arrive later on this afternoon, and I know that many are in anticipation of their arrival. Public Health will be working on a schedule for the vaccine rollout and will release that as early as next week. They are also in conversations with various private pediatric clinics to partner in the administration of the vaccine to their patients, understanding how important it is our children have built up those rapport and relationships with their pediatricians. Public Health is also in conversation with the schools and anticipate making it available in the district clinics as well. So, for the love of your child, your family, your community, and your country, please have your children vaccinated against COVID-19. Thank you.
Thank you very much, Mr. Turner. We now go to Minister for Tourism and Transport, the Honorable Kenneth Bryan.
Thank you, Donna. I'd like to wish a pleasant good afternoon to all of those who have tuned in via the various media platforms and social media, as well as to those who are joining us here in the studio. As the Minister responsible for Tourism and Transport, I am very happy to say that these changes are going to have a positive impact, no pun intended, in respect to what the Honourable Premier and Honourable Minister of Health has said to our tourism industry. As you heard, the requirements for travellers to undergo repeated LFT testing following arrival will fall away, as well as the testing for travelling between Grand Cayman and Little Cayman. This is significant policy change, will be welcomed news by all inbound and inter-island travellers, and will allow people to save time, money, and the inconvenience of having to repeatedly submit testing. From a tourism perspective, in particular though, these changes will improve our attractiveness to international visitors and will boost our ongoing efforts by my ministry and others to increase our stayover visitation. Feedback received from the industry partners highlighted that the LFT testing regime was presenting major hurdles for visitors. Many were not happy with having to line up 3 different days during their vacation to take certified tests, which took away precious time from their ability to enjoy our amazing beaches and attractions. I'm certain that the industry is breathing a collective sigh of relief on hearing the announcement today by the Honourable Premier and Minister of Health. In addition to the changes to the LFT testing regimes, bars and nightclubs have been granted the approval to return back to normal licensing hours. This change will enable local businesses to cater to more patrons for a longer period of time and potentially increase their earnings. We are well aware of how hard it has been for businesses in general to keep their doors open through the pandemic. But for the tourism businesses, the struggle has been even harder as they've tried to best cope. So every opportunity for them to earn some revenue is welcomed. And it is, as it could mean that someone could be able to retain their job or stay in their job a lot longer for more money. Aside from that, it is important that I highlight that local bars are not often thought of as an asset to the tourism industry, but they too play a part, a very important role, I may say. Visitors are always looking for experiences
an opportunity for a new and authentic feel, and bars that feature local bands and have local music and local food often offer an alternative to the atmosphere within the hotel setting. There is no question that our tourism product needs to be balanced and offer a range of experiences which appeals to a wide audience. And with this, local bars and restaurants being able to have musicians, artists, and craft people all will add something unique to the authenticity of what the visitors are seeking. With all that being said, the changes which will have the widest reaching impact to our tourism sector is the increase in attendance at public gatherings. I say this because our islands is a popular destination for meetings, events, and conferences, and the new regulations will place hotels and other venues in more favorable position to accept larger group bookings, which is being called on by the hotel industry. Events of this kind tend to incorporate the need for support services such as transportation, entertainment, food and beverage, tours, and destination activities, which allows the venue to spread amongst more of the businesses on island. Ultimately, when the scale and frequency of these events increase, it drives corresponding need for additional staff to service the groups, which means more jobs and provides a great guest experience. It is extremely satisfying to see that we have reached this stage where the public health officials are comfortable to implement sweeping amendments which we can all look forward to benefiting from, especially when it comes to family gatherings, weddings, and other such celebrations. The fact that the government is able to take these decisions and gradually return back to normal, even though we're still with having COVID in our midst, is a positive thing for the country. Although these modifications will hugely be beneficial to the tourism industry, I think it's important to emphasize, though, that these decisions are a result of constant analysis from looking at the rate of infection locally and examining what the science and data is telling us. And I mention this because I want everyone to understand that even with the relaxing of these regulations, safeguarding the health and safety of the public remains the top of this government's priority. With that being said, I would like to now move quickly to provide a latest update in regarding to the international airlines, and that's why I'm out of breath because I ran late to the press conference today. Welcoming American Airlines, welcome back to that airline, one of our top providers. But last Saturday, the 12th of February, I had the opportunity to welcome back United Airlines, which has resumed its operations in Cayman from four locations, namely New York, Washington, Chicago, and Houston. Just to give you an idea of the passenger arrivals on that day, with 4 United Airlines flights had combined with 716 seats, and I am informed that 561 of those seats were full, which translates to over 72% of that airline seat capacity being filled, which is a good sign. Today, we're excited to welcome American Airlines, as I said before, which has resumed daily service from Miami and will offer 2 flights on Saturday. From March the 5th, American Airlines will also offer services from Charlotte, North Carolina to Cayman, and will add Philadelphia in April. In March, though, both Delta and Southwest will resume flying to the Cayman Islands. From March the 5th, Delta will offer twice weekly service from Atlanta, Georgia, which will operate on Saturdays and Sundays. On March the 10th, Southwest will commence daily flights from Fort Lauderdale and will include weekly flights from Baltimore starting 2 days later on March the 12th. And of course, we cannot forget our beloved national airline, Cayman Airways, which begins weekly service from Denver, Colorado on February the 26th. As you can tell, our numbers are starting to increase tremendously, which is great signs. International flights are a crucial element to our recovery efforts, and I'm pleased that our dialogue with the airline partners is paying dividends, with so many airlines returning, bringing our visitors to experience our amazing people, beautiful environment, and awesome tourism product. Moving on now to stayover to cruise. Given that the cruise sector represents a significant portion of our tourism product mix, it provides jobs for thousands of Caymanians. I would be remiss of me if I neglected to update the public about the most recent developments. Earlier this month, I had the opportunity to meet with the president of the Florida Caribbean Cruise Line Association and her senior executives, representing all of the major cruise lines that visit the Cayman Islands, to discuss the way forward by restarting cruise tourism in the cruise tourism industry. Central to our discussions, though, was the focus on health and safety protocols that would need to be put in place to allow cruise ships to return to our shores. The Minister of Health and Wellness, the Honorable Sabrina Turner, and the Chief Medical Officer, Dr. Newton, were present to provide their perspectives and their guidance on this important topic and weighed in on the discussions. Since then, Dr. Newton and the health practitioners of the various cruise lines have all met together via Zoom to drill down even further into their health and safety protocols that they have put in place to protect the well-being of the passengers aboard their ships. During the cruise and prior to disembarking at the port of call. I'm happy to say that the meetings were extremely productive, and we have gained many insights and provided significant enough information to allow the government to make some very important decisions. The protocols establishing how the cruise calls will be managed from a health and safety perspective are currently being considered, so it would be premature of me to go into any further details at this stage. But I must say this, though. In the meantime, for those who are in the cruise sector, it is time for you to start getting ready. If you need to bring back staff to work, start contacting them now. And if you need to hire new employees, please focus on hiring Caymanians first. I expect to be making some exciting news announcements next week, so I'm encouraging everyone, especially those in the business community, attractions, and tour operators in the cruise sector, to stay tuned to all of the government media channels as we make sure to keep you updated with these important details. As I said before, but it bears repeating, the steps that the PAC administration has been able to take so far to rebuild and revitalize our tourism industry, and the announcements that are coming next week in regard to cruise will be good for cruise tourism, for tourism as a whole, and good for our economy, and will be especially good for the people who depend on the tourism industry for their livelihoods and jobs. Thank you, Donna.
Minister Bryan, we now go finally to the Deputy Premier, the Honourable Christopher Saunders.
Thank you very much, Donna, and it's great to be back here. Just want to use this opportunity to provide the public a little bit of preliminary information that we have for the 2021 financial year. I'm pleased to report that the preliminary results that we have for 2021, we're looking at a small deficit of 10 million, which is actually pretty good, considering that the SPS, when we did the forecast 3 months after the administration started, we're looking at around 50 million deficit. And the preview, which was done prior to this government arriving, when we started, we're looking at roughly a $98 million deficit. So the good news is that we're not as bad as when we started out. And the public may remember that the 98 million forecasted deficit also did not include any stipend payments past the month of May. So from that, if we had included that, we'd look about maybe 133 million deficit. So to have achieved 10 million deficit from the whole in which we started at 10 million, I think that's actually pretty good. And I want to start by thanking my colleagues for the approach that they took in terms of really getting down into the nitty-gritty, and also the civil service, the Deputy Governor, His Excellency the Governor, everyone, because it was a combined team effort to make sure that our results were not as bad as we thought that they would have been. So that's actually some of the pretty good news that we have. Again, we're still finalizing the numbers for 2021, but roughly we're looking at around a 10 million deficit now for 2021. The month of January started off pretty good. We're still finalizing the numbers, but we're looking at roughly 169 million surplus at the end of January, from 238 million in revenues and 69 million in costs. And again, we're still finalizing those, but we expect those numbers at least to remain strong. One of the other good news that I want to share is that we have received the preliminary results for the census. So a lot of people were actually finalizing a press release that should probably go out maybe this afternoon or tomorrow. But just initially, we have 69,656 people counted as per the census. And what is actually not included is actually we still had around 958 homes that we did not get to. So if we did include those 958 homes, at least using an average of 2.4 resident per home, we probably would have seen a number much higher, above the 69 million. And also on Island for Census Day, we had also 2,350 temporary residents. As many people know that we do have a lot of condos, owners and so forth in Cayman, but because they're not here for more than 6 months of the year, they're not included in the population. But nonetheless, as part of the government, we consider that population in any infrastructure development that we may have. So by about June of this year, we should have the full census full census results. And as more information becomes available throughout the time, we'll make those information available. So while we may have the full report in June, nonetheless, as salient information or public information comes available, we'll be more than willing to share. Just wanted a little bit of house cleaning also, taking off my Minister of Finance hat and putting on my Minister of Border Control cap. We do also recognize that there were a little bit of hiccups with regards to the stipend for this month. Is one of the things that we have, we kind of expected that there would have been some pushback initially, but I want to also thank my the Premier and my other PAC colleagues for the support, because one of the things that we were actually working on in the ministry was to actually transition people more from to a labor program. So we've been meeting with other stakeholders. Just today we met with Michael Miles from the Inspire Cayman program. We've been working with him to get people certified and everything else and kind of work ready. And I mean, yesterday we met with the chamber again also just to reiterate, as Minister Bryan pointed out, that we want Caymanians to be given priority. A lot of people focus on how much work permits are being processed. And one thing I did ask the business community is to also focus on how many Cayman applications that their HR departments are processing for our people. Just like with anything else, we expect it to be a joint partnership. And it is important for everyone to recognize that where this government stands is that the Cayman Islands must remain a private sector-driven economy. I mean, anything other than that, we're going to start eroding the successes that we have had. So tomorrow morning, I'm on OC show with my team to kind of kickstart our jobs program. We have in the both printed newspapers tomorrow. There's going to be a big center spread of all the jobs available. We have over 800 jobs listed on Jobs Cayman portal. We have over 300 different employers. So we have put all of that out as an ad, and we'll be doing that now for each week going forward. We've also been making some changes to the Jobs Cayman website. We're looking to overhaul it completely to make it real exciting for a lot of people to use. But all I can say for now is watch this space. But I just wanted to thank the Premier for giving us opportunity to at least use this moment to advise the public or inform the public that we're getting ready to kickstart that program tomorrow. So, it's going to be an exciting time. So I just wanted to get that off out to the public while we had this press conference today. And Premier, thanks again for giving me this opportunity.
Okay, thank you very much, Deputy Premier Saunders. We're going to go to questions from the media. I actually will start the questions off today. The first question is, Deputy Premier, you talked about some 800 jobs that are available to Caymanians. However, there are some Caymanians who are not vaccinated, don't want to get vaccinated. They may be few and far between, but they find that when they go out to look for jobs, first question they're asked is, are you vaccinated? And 9 times out of 10, they're not getting the jobs, and they're tying it to the link that they're not vaccinated. What does the government have to say about that?
Well, actually, I mean, first of all, it is important that employers, to some extent, because not all jobs are the same. I mean, if jobs are, for example, you're working in a nursing home, a care home, it's important to some extent that there are certain safety protocols in place. So it's not we want to sit down and dictate in terms of what it is that employers have, because I know different companies have different requirements. And so it's not a one-size-fits-all. And I think it's important for people to recognize that when the government passes legislation or even regulations, it's very difficult to carve out for a particular piece. So the easiest thing I would say to people is that, listen, first of all, get vaccinated. I mean, it is still the best and safest way. It's better for the community. Although we do accept that some people for medical reasons and other personal reasons can't be vaccinated. But nonetheless, I would encourage everyone to get vaccinated. Now, if employers are doing that in terms of using that as discrimination, then that is something different for us to look into. And I'll take a look at that one offline.
Okay. Now we're going to go to Andrell Harris for questions from the media. And thank you, Deputy Premier.
No problem.
Premier Panton. Premier, in light of the announcements here today, the restrictions that have been eased, what more, or when will we see a complete relaxing of the restrictions? What will it take to get to that point? And at what time does government envision us reaching there?
Thank you very much, Andrel. The reality is our actions, as I said during my remarks, are based on the best advice available to us. Public health advice, the medical officer of health, the chief medical officer, and of course they often consult with their regional colleagues, other overseas territories colleagues, and Public Health England, or what's now called the UK Health Security Agency. When we feel that, or they feel that the numbers or the caseloads have reduced to a point that we can safely make changes, and they make those recommendations to us, then we will consider those. We don't have a specific time frame for that, obviously, because we have to wait to see how things develop. And we've left in place a minimal amount of restrictions and controls to try to make sure that we keep the numbers going in the right direction, going down, and to maintain our level of safety and to protect our health services across the island. So it is not an easy answer. It's not something that I can give you that it's a formula, but it is absolutely going to be based on the advice that we get, which tells us it is now safe to make these changes. Clearly, we do want to make changes as soon as we're advised it is safe to do so. We're not interested in trying to just inconvenience people for the sake of it. We're in the business of trying to make the lives of our people better, and anything that inconveniences them is going to be something we're concerned about, and we're going to look to try to change and remove and eliminate based on the advice.
For fear of it being labeled a follow-up question, a separate question, I dare say, is the 60% target for the booster shot contingent on the eventual relaxation of the remaining requirements?
No, we are aiming the 60% target. I think it originated from where the UK was, what the UK had achieved some time ago, and our view was if we can achieve a very high vaccination rate, setting our population number at 71,000 when the official estimate was still 65, we ought to be able to achieve at least 60% booster levels in this country as well. So that's where that came from, and we're pushing to try to get the booster levels as high as possible. That had nothing to do with any sort of precondition or anything along those lines. So I'm not sure where that perspective came from, but that doesn't have any basis in fact in terms of our consideration.
Duly noted. Not entirely sure who this one would be for, but it says that travelers can now get out of quarantine with 2 LFTs. Why can't Caymanians and our residents?
Sorry, travelers. The new changes will allow travelers to get out after two sequential LFT negative LS or consecutive negative LFTs. But those are travelers. Those are not people that are positives. I'm assuming when you say Caymanians, you mean Caymanians who have been found positive.
A bit right.
And clearly those are different scenarios. If someone is if a traveler comes in, if someone comes in that has to do quarantine, if during the time of that quarantine they test positive, they're going to be subjected to the same clearing requirements as any other positive person in the country, Caymanian or not.
And I dare say my final question, the actual stipend, perhaps, well, no longer with Minister Bryan, Deputy Premier Saunders. What efforts are government doing to actually wean people off of the government stipend? And what evidence is there to suggest that it's actually successful?
Well, first of all, wean seems like we're dealing with babies, so I don't like that choice of word, because we're talking about adults and people's livelihoods. Yeah. What we do recognize, first of all, is that the vast majority of the people that are receiving a stipend are people who do need a stipend. What we have found since being transferred to the Ministry of Border Control and Labor is that there have been abuses within the system. Considering, when the stipend started more than 18 months ago, and at the time we were in full lockdown, so some people's financial situations would have changed since. I'll give you, for example, we have found cases where employers who have active work permits are submitting work permits for non-Caymanians, paying the work permit fees, actually getting a stipend. Now, if you can afford the cost of a work permit to hire a non-Cayman national, I don't see why you should be on a stipend. That's just me speaking personally. Equally, there have been people who, on their own accord, have actually volunteered to exit the program. And for those Caymanians, I really want to say thank you, because if your situations have changed and you no longer need it, I think that's really the honorable thing to do. And we have had many cases where people have actually done that. So I think that in itself is pretty good. Where we do have our challenges is with the abuses within the system. Some people have been fully employed, are back to pre-pandemic levels in terms of income, and they're still pushing to get the stipend. I think that is really immoral. I think it is wrong, because there are people out there who genuinely need the help. We do recognize that some people have gone back to work, and granted, while they may be having full-time hours in the tourism industry, the gratuities and everything else that they would normally make would not be where they were pre-pandemic. That's the reason why we now have the Tourism Recovery Grant Program, where there be no transition off away from the $1,500, where they receive $1,000 for this month and $750 for next month. Those people are honest enough to say at least they were fully employed. What we have agreed to do is in the month of March again, because we do recognize that one, of the amount of people who are getting a stipend, roughly 40% are related to cruise. So even if there's some activity in the cruise industry that Minister Bryan is working very hard to bring back, we do recognize that some of those people will take them a while to catch back to where they were. And as such, we are prepared at this point to go back to the Finance Committee and say to the members of Parliament, we'll need additional funding for people, especially within the cruise industry, who will not be back at 100% of where it was. Equally, we do recognize that this is the high season, for tourism high season now. We would have missed a lot of it, and there are people who will still not make the amount of gratuity that they normally would have made. So again, we're prepared to continue. So we're going to keep evaluating the program. What I can say is that we are hunting those who, I would say, are a little bit fraudulent within the system. We have had people who have already left the island that are still basically getting stipend. When we have people who are fully employed, we have people who have since joined the civil service. There are litany of different issues, but what I want to say is that they are still in the minority. They're still in the minority. The vast recipients, or the vast people who do receive it, are people who genuinely need it, and that is what we need to do. What we need to make sure of also is that as we transition from the displaced tourism worker stipend to the Tourism Recovery Grant, is that we're also now using this opportunity to get people ready. We have had people who have approached us. That's the reason why we're speaking to other entities such as Inspire Cayman, where they want to be certified. People have been home for a very long time. They're a bit rusty. They want to catch up on some skills, and we're making those things available to them. So tomorrow morning, again, I will tell everyone, if there's one time to buy the Compass and the Caymanian Times, it's tomorrow. We have all the listening jobs. We're going to be doing that on a weekly basis. We're going to be pushing out because jobs are available here. Again, just recently, one of the things that we have noticed is last year, for example, of the roughly 35,000 decisions that the Department of Work dealt with, more than 15,000 of those actually related to temporary work permits. So we do recognize that there are some challenges within the temporary work permit system, and right now the government is actually looking at a policy. We were actually looking to make the legislative changes where any temporary work permit over 30 days is basically something that people advertise, at least on the Jobs Cayman portal. So at a minimum, we'll have more jobs available, because even though there are 800 jobs listed, we do recognize from the amount of temporaries that eventually that may go on to full-time grants, and people are using that as a kind of loophole. There are definitely more jobs available, and we also want to tighten up on that regime. So to answer your question in a roundabout way, and I'm sorry for the long answer, but it is a matter of working with our people, and that's really what it comes down to. This is a partnership. That's why I went yesterday and I met with the Chamber of Commerce and said, guys, listen, just as though you would expect us to protect your businesses from foreign competition or from foreign influences or unfair competition, you will also have to expect from me as a Minister of Labour that I will also want to do the same thing, in the sense of also protecting our people from especially the cheap labor that is there. But the main thing for right now is actually getting our people back to work. Our people want to work, and that's really what it comes down to. This is who we are.
Okay, thank you. And I know Donna's going to kick me off. Just following up on that point of hunting the people who are taking advantage, will the government or will the people who are found to be taking advantage of this system be prosecuted?
I want them people. I do recognize that people have their own personal challenges. And sometimes some people look at it as free money, and maybe they have genuine reasons why they probably would need it. It is a hardship situation, and we do recognize that. Because even prior to the pandemic, we also got to recognize that some people still really wasn't making sufficient income. So not because they may be back to where they were, it doesn't mean that that was even sufficient. What the short answer is, no. I mean, the whole idea of government going and hunting people like that, the resources they got to spend isn't really worth it. We're just going to ask them to do the right thing. And it is a small community, and the last thing you want to do is name and shame anyone.
Thank you. And the only thing else I might say is every Friday is a good day to buy the compass.
Yeah.
Thank you very much.
Good response.
Thank you very much, Andrell. We're now going to go to Zoom. Sandy from CMR is standing by. Sandy, please go ahead with your questions.
Good afternoon. The one question I had was in relation to collaboration between labor and NAU. One of the complaints that we continually hear from people in the community is if they're being taken off the stipend, there might still be a need for them to get some assistance, and they're being told that the logical agency for that is a needs assessment unit. But there continues to be a very high volume of complaints about NAU, whether it's lost applications. I mean, I heard of a young lady this morning who claims that NAU has requested the exact same paperwork from her on 3 or 4 separate occasions, and her application has not been advanced. And it's now a number of months, and she's actually homeless and literally living on a beach under a tent. So I just wonder what sort of collaborative efforts can we see happening between the needs assessment unit and that ministry and labor, as well as, will someone be assigned to kind of assist people transitioning off of the tourism stipend to then get, if necessary, assistance from the needs assessment unit? Thank you.
I can say that we are working with NAU in that regard. I can tell you from statistics, only people that receive the stipend also receive NAU assistance. And again, we look at everything on a case-by-case basis. What I can say is that Minister Andre is actually working on some legislative changes. And additionally, on top of all of that, we have also included in this year's budget far more resources than in any way, especially to get more people, not only assistance, but also from an administrative standpoint. What I can say is that we are also looking at the best way in which to make this system far more efficient. It is still very paper-based. We think a lot of it can be done online, and that alone will do away with a lot of papers being lost. I can tell you we have the same problem in work, we have the same problem in CBC, and that's one of the things that we are looking at where we can get all of this done. What I can say is that the e-government initiative is fully started. Matter of fact, we have demo cards out there, and I would say to some people, this is a good time to probably start using it, but it is something that we're looking at. And yes, Sandy, one of the things that we're trying to avoid is the silos that we had before. So I can tell you, we have a very active caucus. we speak a lot, we collaborate a lot, and all I can say for now is just watch the space, because I think Minister Andre will have some very exciting news, at least within the first quarter year before the end of March, to announce.
Okay, Sandy, thank you for that question. We're now going to go to Wendy from Cayman News Service. Wendy, please go ahead with your questions.
Hi, thanks, Donna. Appreciate that. Sorry, I did miss some of the questions because there was some noise on the line. So if I repeat anything, I apologise. But the first thing I just want to go back to is the situation with the stipends. And if somebody can just clarify why the message went out, first of all, that people were getting thrown off completely and like cut adrift straight away. And then literally, it seems like only a day or so later, they got told that actually there was going to be a transition. Can we just explain what the mix-up was there?
Actually, it's not a matter of thrown off. If you go back to the program when it started, it was pretty much for people who ceased working literally overnight, like literally people lost their income. What we found from actually doing the postmortem, or the postmortem that was started thus far, is that it's a combination between some of the survey questions and how the survey was actually answered. So when people basically stated that they were full-time, what we found out in many cases is that while their hours may have been full-time, their income, especially those in tourism that receive gratuity, was not at the full-time level. So in essence, the question that we in hindsight should have been in terms of your income as opposed to your job status. So in that situation, no, they weren't making what they were making before. So Premier and the other colleagues last night, we basically had the discussion on that. And again, I want to thank the Premier for his support in that regard. After recognizing that not people, while they were working full-time, they weren't at their previous levels in terms of income, that's when we decided to say, well, you know what? We realized the question could have been a little bit different. The answers could have been a little bit different. That's the reason. And we corrected it because I think it actually went out the same last night, if not early this morning, to advise them that for this month, for the month of February, they'll be receiving 1,000, then they'll be 750. And again, we'll do the survey again in March just to see if their situation have changed. Because like I said, we do recognize it is fluid. Again, I want to use this opportunity to thank the many people who actually volunteered to come on the program. And again, this is part of the teething process. We always knew that the minute it started, it was never going to be easy from an adjustment standpoint, but we learn as we go and we learn as we grow.
Thank you, appreciate that. Following up on the fact that you said we're not prosecuting anybody for, any fraudulent acts or whatever, can you just clarify, A, how many people were taking the stipend whilst they were in prison, and whether you've managed to put a stop to all that now?
What I can say is this, is that we are scrubbing the list in terms of verifying it. The advantage that my ministry has is that, one, we have access to other databases that other ministries wouldn't have. You know what I mean? So from that standpoint, at the end of the day, what I want to say is this. The vast majority of people receiving a stipend, if not all, are Caymanians. And we do recognize that people have different challenges, people interpret things differently. And I am not prepared at this point to spend limited resources that my ministry already have chasing people. I'll prefer use those resources to go help my people find jobs. So for the few that are there, it's not worth the effort. We find them, we just stop paying them, but our effort is best spent on trying to get people that help in Anthony to go get employment, because what people really want is jobs.
Okay, you can just confirm no one in prison is getting a stipend anymore.
I can confirm no one in prison will be getting a stipend anymore. Not much I would say.
Okay, great.
Wendy, if I can just add a little context to the prison element, that sometimes people don't take the full context of the circumstances before coming to a conclusion. For example, hypothetically speaking, a young man finds himself in a difficulty being on a stipend for 8 months after the pandemic and gets caught driving without a license, and he gets sentenced to prison for 30 days. He still has to come back out. He still won't have a job. The economy is still the way it is, and he still does have to provide for his family. So sometimes it's not as exact as it may seem. It's not, for example, a different circumstance where a person has been convicted for 10 years and you know they're not going back to tourism anytime soon.
Yeah. Yeah.
So I just want us to take these things in context. It's a difficult task to decide to take away money from the people that you represent. but we do have an obligation to be responsible. And that balancing act is one that we're not going to be perfect at. And we're going to continue to promise to listen to the public as to what's going on and analyze the situation so we can continue to provide for them. But what should be more important, focused on today, is all the amazing news that came out today that will help the industry. All of those who were depending on the stipend, that the next couple of weeks and the next month and a half will be so positive in respect to working opportunities that maybe we may not be talking about this matter in respect to stipend for very much longer.
But I can
Okay,
say
great.
also, from the lessons learned from this, we're actually adjusting some of the survey questions to literally give us better data. And that's pretty much what it is that we need. We need information so we can make informed decisions.
That makes sense. Talking of the relaxation of the measures, as Mr. Bryant just brought up, can I just clarify why we've made a decision to reduce the isolation for those who are unvaccinated to 7 days, but we're not touching the same period for those that are vaccinated, when perhaps it's an opportunity to say, if you're boosted, you could reduce it to 3 days, to 5 days, for example. I'm just throwing that out there, but why no change to the isolation period for those who are vaccinated?
So, Wendy, if I'm understanding you correctly, you're asking why we have reduced the unvaxxed and the not fully vaxxed to 7 days quarantine on traveling.
No, on people who are positive. So the local people who test positive, but they're vaccinated, they still now have to isolate for 7 days, the same as somebody who's unvaccinated. So I'm just checking why we haven't decided to reduce that period, say, for 5 days before they can get a test.
We have not had that advice given to us. I don't know if Minister Turner has anything more specific in respect to that, but that is not a part of the advice that we have had. We do have the Medical Officer of Health. I keep getting them mixed up between CMO and MOH. We do have the Medical Officer of Health here who can explain more fully the circumstances around your question. So we would invite him to do so.
Thanks.
Hi, good afternoon. So actually the reduction.
I can't hear. Sorry.
Mike?
The mic is,
Sure.
it's on.
It's on. Can you hear me now?
Yeah. Thank you. Thanks, Dr. Williams.
Right, yeah, thanks for the question. So the reduction actually for the unvaccinated, as the Premier has just mentioned, is for unvaccinated travelers to be in quarantine. For unvaccinated positive cases, people who are in isolation, they will still remain in isolation for 10 days. And those vaccinated will remain for 7. However, looking for your question, we have had discussion with the interim CMO about a further reduction for those in isolation as well. And we will have further discussion on that and advise the government accordingly.
Okay, great. Can I also, I've got a couple more very quick sort of public health questions, if I could ask them. The one is, can you explain why we managed to miss a death on the count that's now been added to the count, how that happened, and also why we've had no details at all on active cases for over a week, given that the active caseload number is pretty important to the business community, as that's what's really impacting the economy at the moment.
All right, I can give you the active cases number of today is actually 2,406 cases, active cases as of today. Regarding that death number 17, we have been doing a review of our data and all the deaths that have happened since the beginning of the pandemic. And we went into more details and actually some death and to see if there were any association between this death and COVID. And we did find out there was a death early this year that was actually a patient that we could associate that death with COVID. And that's why the numbers, the 17 deaths come up.
So it was somebody you didn't know had COVID and then you've now discovered that they did?
There was an investigation done after the death of the patient, of course, autopsy, and then we recovered that the patient had COVID, and then that's why we added to the
I see, so it was the
count.
autopsy that brought it up?
Yes.
Okay, thank you. Appreciate it, I understand.
I just want to add one more detail. Currently, we have 8 patients admitted, 7 at the HSA and 1 at Health City, Cayman Island. And out of the 7 at the HSA, 4 of them are in CCU, and 3 are ventilated. Why I want to bring this up is because all 8 of these patients are unvaccinated. And I just want to reinforce the importance of being vaccinated, and not only being vaccinated, but the booster vaccine.
Okay, great.
Thank you.
And I think that'll do for me, Donna. Thank you very much.
Thank you very much, Wendy. We're now going to go to April over at Radio Cayman. April?
Hi, everybody. Thank you very much. Can you hear me okay?
Yes.
Okay, sorry, I've been punching buttons back and forth. I think this would probably be best for the tourism minister. I know that a lot of these changes are going to be seen as positive by the industry, but are there any sort of still areas of concern or obstacles from the tourism sector's perspective that need to be addressed, short of, lifting all restrictions of all kind, that they think will help them get through this period as successfully as possible?
Thank you, April. It's lovely to see you. There's always going to be ways to improve. Some of the things is employment, but that is a very touchy one as we are maintaining our Cayman first approach to that. Trying to understand better, as you heard from the Honourable Deputy Premier, also Minister for Labour, our focus on that. So we're trying to hold our hand because we know that there are some parties who are not doing their part and doing a concerted effort to find Caymanians. So that's one. The other one that may become a bit of a hurdle still, which is not a fault of our own as of today, which is the potential to be found positive once you're tested to go back to your jurisdiction. And thankfully, we will no longer be held accountable for that. So I think one day, once the restrictions for the United States, which is our main stakeholder for tourism, over 80%, that issue will go away and people will be worried about if I go to the Caribbean and get stuck there. Because obviously, if you go into quarantine or isolation, there's budgetary constraints. There's time that you only allocate enough time for your vacation. You got work problems. There's so many other things that come along with it. But I think the changes today substantially would have addressed almost 85% of the issues that the industry is saying. But I'm certain they're going to come up with some new ones. Every time we make some changes, the next day we get an email with some more. But our job is to continue to assess and make it as easy as possible so the tourists can have a good experience in the Cayman Islands.
And I know I told Donna I only had one question, but this is just a follow-up to that. So with the majority of the concerns kind of out of the way, and we're seeing, as you've said, more and more flights coming in, where would you say we are right now on our, return to tourism as it once was spectrum, cruise ship stuff aside, of course?
Well, we're definitely climbing up the ladder. I wouldn't want to give a number or a figure because it'd be just taken off the top of my head. But my gut is telling me, based on the last examination I did, is that we're past what we projected to be at this point, which is great. I hope to have a more extensive set of data to provide for you as the Department of Tourism's job to continue to monitor that, because obviously it reflects on our revenues and we've made our budgets based on projections. So, and I'm obligated to meet with the Honourable Minister for Finance, Deputy Premier, and update him every quarter on where we are with our finances. So I'll probably be able to give you a better answer soon.
Thank you very much. I appreciate it.
Just to add to the and considering last Friday with United returning with 4 flights, the total international arrivals just last Saturday alone was just under 1,200 folks, and we're still, some will be local, some will be tourists, so we're still sorting out which is which. But the good news is that was a very active day at the airport, and that's actually pretty good. So, Minister Bryan, I will get my team to try to get those numbers to your team as quickly as possible.
Well, April, I would just add as well, if everybody else is adding. I'm going to go out a bit further than my colleague, the Minister for Tourism, and I'm going to say it's 95% of the concerns that were being addressed. Setting aside cruise, I'm saying 95%. The two main issues that were identified to me in the past few weeks were, one, the gathering limits, which impacted the size of groups that hotels could get in, and secondly, it was the day 257 LFT testing regime. Both of those, as of tomorrow morning, will be addressed. So I know I've already had messages on my phone from some of the biggest stakeholders, tourism stakeholders in the country, saying, thank you very much. We look forward to working together to continue to build tourism in this country. And we certainly will continue to address whatever issues we can. And we look forward to working with them to ensuring that our Caymanian people get back to working and being fully employed, and opportunities to be there for as many of them as possible.
Thank you all very much. I really appreciate that.
Thank you very much, April. We're now going to go to Ralph from the Caymanian Times. Ralph?
Good afternoon, Donna, and good afternoon, members of the panel. It's great to be back.
Good afternoon.
Just a few questions and maybe a statement. Number one, regarding regulations, are there any changes to the numbers of people regarding in contact sports?
The numbers for outdoor gathering has obviously increased to 1,000, which includes both spectators as well as participants. So they will no longer be required to wear masks as well. So those are two important changes that have been made in the new regulations, which come into effect tomorrow morning.
Very good. And I, along with many others, are happy to hear about the relaxing of the regulations, which will help us get the economy back on track. And my concern is for the small business who may need some time to get their act together, get their business rolling again, and also they may be able to hire employees. Is the assistance given to small business going to continue for some time still?
That program obviously runs through our colleague Minister Andre Ebanks's ministry. Yes, is the short answer. There are different programs that are available to support small businesses, and obviously he's not here today to answer specific questions in relation to that. But the general response is yes. We are looking to continue to support our people wherever we can, and we're looking to support small businesses as far as we can in order to help them get back on their feet and be able to participate fully. The economy is starting to roll along. We're getting a lot more tourists coming in, and we're going to have cruise starting to feature in the coming weeks. So that's something very, very positive for this country at this point.
So just to add to that, Ralph, recognizing also that it takes cash to care, what I can say is that the Ministry of Commerce has actually been working with my ministry in terms of actually working on something to actually support the other small businesses financially. And I suspect, again, that will be something that will be coming to Parliament or Finance Committee next month to get support from all members of Parliament in that regard. And I think it's safe enough to me to speak on behalf of the opposition that I think they'll actually support that in advance also.
Okay, thank you. And I'll stay with Mr. Saunders for a few more minutes. First of all, I want to thank you for considering putting the jobs back in the newspapers. And starting tomorrow, of course, Caymanian Times will have its set of jobs in there, and we encourage people to look at them to try and find job vacancies.
I think a discount too on the rate.
Definitely, yeah. We're doing all we can because I think we're in this whole thing together. We want to see people back to work, and it's not good to be unemployed. And anything that we can do. And the point that we're trying to make earlier is that there are different sources that people get their job information from, and the newspaper is definitely one of them. And we thank you very much for that. And I have one more question. That's for the Minister of Health.
Go right ahead.
Can you explain a little bit about long COVID or the long-term impacts of the COVID to those people who may have had this disease and may have recovered?
I will defer that to Dr. Williams Rodriguez, but thanks for the question.
Thank you.
Hi, Ralph. Thanks for the question. Are you referring to long COVID here in the Cayman Islands or internationally?
Yes. There's been discussions about long COVID and how it will impact people's health in the future, even after they've recovered from the main symptoms. Can you
Yeah.
explain a little bit? Yeah.
Yeah, there are different studies international about the effect of long COVID for how they will affect it. Actually, we are in the process right here now in the Cayman Island of collecting data, sufficient data of patients that have been referring lung repercussions from the COVID infection as early as COVID infection late in 2020. And we have at least 5 patients that are still struggling with symptoms. So we will be able, once we have all the data together, to provide more detail into that. But we are aware of cases, and like I said, at least 5 cases that all the way back from 2020, they are having still some symptoms and sequels from the COVID infection at the time.
Okay, thank you very much.
Thank you.
And thank you, Don. That's all for me for today. Thank you very much.
All right, thank you very much, Ralph. And last but certainly not least, we go to John Fleming from Cayman Real News. John?
Thank you, Donna, and good afternoon, panelists. I just have a few questions. My first question is to the Minister of Border Control and Labor. And it's just to give an update on delayed work permit renewals and applications. I've had 2 messages today, one saying that somebody's had a work permit renewal in since December. And it was just a general update on the delayed work permit renewals.
What I can say is, and this is one of the reasons why we're pushing to get the system online, what's normally missing from when people say that they submit an application, in many cases where there are delays, you find out that information is actually incomplete and that the people within the work department have to go back out and chase people for information. Now, the quickest thing, ultimately, we want to make a decision because we do recognize that in many cases, these businesses are also owned by Caymanians, and the last thing we want is for any Caymanian entrepreneur to be disadvantaged or not be in a position to provide the goods or services that he or she wants to sell. But one of the things why we're pushing the online system is that we want a system where if the information is incomplete, it will not allow you to upload. In some cases, just before a work permit is about to be renewed, people just go drop it off quickly just so they can say they got it in, when they themselves sometimes know that information is incomplete. No, what I don't want to say to my team is that if the information is incomplete, that's automatically say no. I think that would basically send the wrong message that the Cayman Islands isn't open for business. Equally also, what you're going to find is that in many cases now, we're actually looking between people who are actually applying for jobs versus work permits that are also being renewed. Because as we said, we do have a lot of Caymanians that still out for work. So there is now an increased number of vigilance also with regards to work permits just being automatically renewed. Yes, I know some people are used to it being done in the past, but at this point, people have to recognize that there are many Caymanians out of work. And as such, we have to now go through a much longer process to make sure that even the jobs that are being renewed can be filled by Caymanians. So yes, it may not be the usual speed as people would expect, but again, this government ran on getting Caymanians employed. We ran on being people-driven first. And as such, we have to make sure our Caymanians get an opportunity. So it is what it is. What I can also say, John, is that unfortunately, when we do come across cases, because I can tell you, what we have seen in many cases now is that more Caymanians are actually using the complaints portal and actually notifying work when they've actually applied for different jobs. And then you see the application comes in, they say no Caymanian applied, but then we have proof that Caymanians actually applied also. So in some of those cases, we're trying to find even the back and the forth. It could be an administrative error, or it could have just been downright an ability, an intention to mislead. So there is aspects, but what I can say is that it is not going to be as easy and as automatic as people had it before, especially when we have thousands of Caymanians looking work. So the good news is if a work permit renewal is in, the person can continue to work until the decision has been made. But for right now, we're going to make sure that a Caymanian is not available for that job.
Perfect. Thank you so much. I have another question for the Minister of Health, or maybe the Minister of Tourism, actually. And it's just, I've gotten a few questions from people on why they are continuing the use of lateral flow tests for unvaccinated travelers between the sister islands. I understand that they want to keep members of their people living in the sister islands safe, but people just want some clarification on why those who are unvaccinated will still need to get lateral flow tests before traveling to Little Cayman or Cayman Brac.
Thank you for your question, Mr. Fleming. I'll ask Dr. Williams-Rodriguez to break that down for the listening and viewing audience.
Thank you.
All right. Thank you for the question. This particular topic of testing the unvaccinated for traveling to the Sister Island was discussed in a meeting that we have with the interim CMO and Sister Island representative, and also at program board level. And the sentiment and the consensus that in order to continue to be as safe as possible, we'll continue to test those who are unvaccinated. We know that those who are vaccinated can transmit the disease as well, but evidence has shown that the virus lasts less in those who are vaccinated, so hence those unvaccinated individuals are at a higher risk of transmitting the disease to others if they are to be infected.
Perfect, thank you so much. I have one more question, and this is directed either to the Minister of Tourism or the Premier. And that's for considerations for those coming from countries with less than 60% of the vaccination. I've gotten a few messages today from people from countries like South Africa, Jamaica, who have undergone 2 doses of the COVID vaccine, but still have to quarantine for 7 days, which is frustrating for them. So will there be any, leeway for travelers who, they can follow our rules, they can have the vaccines, they can do the required tests, to not have to quarantine from these countries?
The two scenarios there. One is if they can get a QR code, for example, to demonstrate secure vaccination or secure verification, then they don't have to quarantine. There are, I'm not sure, I'm not too familiar with South Africa, but I know, for example, in Jamaica, you can get a QR code. So that's one scenario in which that issue could be avoided. They may have to, to put in some effort into chasing down the opportunity to get the QR code, but it's possible. The other is, at this point, we still think that there is a risk from countries that have lower than 60% first shots. That's just really an indication to us of the level of prevalence and the possibility that they may have. There's a higher chance the traveler may have COVID. So we're not proposing to change that at this point, and we think that that's not an unreasonable position right now. Obviously, as things change going down the road, we will absolutely look at that scenario. We do have countries that are building their vaccine numbers. So as they get to those, I mean, we were considering one today, looking at one today, where they're about to cross the 60% threshold. So that has a positive impact for those that are vaccinated yet unable to verify electronically.
Perfect. That's all from me. Thank you. Have a good evening.
Thank you.
Thank you very much.
Good work, big guy.
Thanks very much, John. Well, as always, if there are any final comments before we go from the panelists?
Well, since because today's announcement has been so amazing for tourism, I just want to thank my colleagues and the medical staff and Dr. Newton and Public Health for constantly analyzing when we were ready. It was something we were dealing with for over the last couple of months because we understand the importance to our second major pillar. So I'm so happy that we are all ready to move forward and really, really look forward to next week for cruise. I'm excited about that too. So that's it for me.
Tomorrow morning, my team from Border Control and Labor will be on the for the record at OC. I think it's at 9 a.m. tomorrow, and I'm going to encourage everyone to please get a copy of the Cayman Compass, the Cayman Times. We're working on the electronic format so we can get it on social media also, all the different jobs that are available. But I'm telling my people, go out. The jobs are there. There are a lot of employers who are looking for people. They're desperate to get work, especially since they're having a hard time sometimes getting their permit renewed on time. So please go and get signed up for work, get registered. There's jobs out there for people.
Premier Panton? Minister for Health?
Just thank you for the opportunity. Tomorrow morning also on Radio Cayman 89.9 FM, Ministry will be on OC show, and that's mainly to dive deeper into and discussions in regards to some of the changes that we've reported here today. And just to let the public know that Public Health will be doing their vaccination clinic starting this evening, 5 o'clock at the Spots Dock. That's from 5 until 8, and it gives me an opportunity as well to state that there will be a public meeting there this evening, Prospect constituency meeting, that will be broadcast live as well on Radio Cayman, where I'll be updating the public. I know the Honourable Premier has promised to attend, and yes, I want to really just, it's more of keeping the engagement with the people and keeping them abreast of what's going on, but more so just keeping my word to the people. Thank you so much.
Okay, Deputy Premier, nothing from you?
No, I'm good because jobs, we want our people working. And I want to thank the many business people too for actually partnering with us, because I can tell you the vast majority of business people out there want to hire Caymanians, and we're working with them to get that done. So again, but like I said, there's some out there that are not as cooperative.
Donna, I want to thank you again. I want to thank my colleagues for being here. And I want to thank those people who have tuned in. And I want to thank the media as well for doing a wonderful job, as usual, of asking really good, searching questions. We have had a good afternoon, a good day. I think there has been a lot of really great news here delivered, which will come into effect tomorrow morning. As my colleague, the Minister for Tourism, indicated, we will probably be doing this again next week, and we hope to have some more interesting or exciting news to be able to announce then. I also want to say it's probably not too early to say have a great weekend, safe weekend to everybody. And there's one special person, Marla, happy birthday to you. We love you. I hope you're having a great one. All righty. Thank you.
You know
all.
what you've just done, though, right? All right. Well, as always, thank you to the public and, of course, to the media for joining us here today, and to our panelists who shared some very important news and information with us. If you'd like to rewatch the press briefing or watch it in its entirety, you can do that on demand on the Cayman Islands Government YouTube channel. Also, remember to go online to gov.ky as well as hsa.ky for any COVID-related information that you may need, or any questions you may need answered. Until next time, we thank you as always for joining us. Have a great evening, everyone.